In this video, we're going to discuss 12 government entitlement programs available to people at all income levels. Coming up next on Holy Schmidt.
Holy Schmidt!
Government entitlement programs are one of the most misunderstood of all things government related. The reason is that most people either don't understand or even know that they exist, or think that they're available only to people at a low income level. So I want to make sure that you get crystal clear about what's available, and the first step is to actually define what a government entitlement program is so you see it when it's in front of you. A government entitlement program is a benefit the government must give to people who meet certain rules. These rules can be based on age, income, health, legal status, or specific circumstances. If someone qualifies, the government is legally required to provide the benefit even if the total cost is higher than expected. Some entitlement programs are funded over time by the beneficiary, like Social Security, where workers contribute through payroll taxes. Others don't require past payments, like SNAP or unemployment benefits. What makes all of them entitlements is simple. If you qualify, you receive the benefit. No waiting list and no limit on how many people can get help. In this video, I'm going to cover 12 government entitlement programs that don't require a low income to qualify. I'll start with the most common that you've probably heard of and work my way down to those that you probably have never heard of. The chances are good that you qualify or will qualify for several of these, so stick around to the end so that you don't miss one or two that might end up useful to you. All right, let's go. The first is Social Security benefits. This is the one that everybody thinks about when they think about government entitlement programs. Social Security is available to just about anybody age 62 years old or older, either as the primary insurance amount for the worker or the spousal benefit for the partner of the worker. This is a major source of income for retirees age 62 years and older, and it's funded entirely from the employee's contributions and the employer match. Those two tax flows go into a trust, and that trust invests in U.S. government securities, and between the contributions to the trust and the interest on the government securities, the retiree receives Social Security. And to be clear, there is no government funding of Social Security. It is entirely funded by employee and employer contributions. To qualify, you have to have what are called work credits, and each credit represents about 3 months worth of work. You need 40 of them. So in other words, you need to work about 10 years in order to qualify for Social Security. There are other de minimis requirements, but in order to get into the program, you need to have a minimum of 10 years or be the spouse of someone who has a minimum of 10 years of work history. Payments increase at a decreasing rate, meaning that you continue to pay taxes all the way up to a reasonably high threshold, but the more you earn, the less each additional dollar of contribution contributes to your own Social Security payment. In order to access Social Security, log on to ssa.gov and go to My Social Security. That's your personal Social Security page, and that will give you all of the details of your earnings and what you qualify for in terms of a payment. There you can also apply to receive Social Security. The link to apply is right under the Estimates table, and it's labeled Start Your Retirement Application Now. Next up is SSDI. SSDI is a benefit program for people who worked, paid into Social Security, and later became disabled and can no longer work. It's not welfare. It's funded the same way that regular Social Security is funded, through FICA taxes. Each time you work and pay into FICA, a small portion of that payment goes into the Disability Insurance Trust Fund. To qualify, you need to satisfy 3 requirements. First, you need to have 10 years of work history. Those that are younger can satisfy this requirement with less work history, but generally 10 years is the benchmark. Second, you have to have a severe medical condition that prevents you from doing any work. And third, you can't earn more than Social Security's substantial gainful activity limit. If you earn more than that, you generally don't qualify. Next up is Medicare. Medicare is the federal health insurance program for people age 65 and older, and also for younger individuals with certain medical conditions. It's funded through payroll taxes, monthly premiums, and federal revenue. Every time you work and you pay FICA taxes, a portion of that payment goes into the Medicare trusts to help pay for Medicare. Qualification is simple. Most people qualify at age 65 if they've worked long enough to receive premium-free Part A. Others qualify earlier through SSDI or a specific medical condition. Medicare has several parts. Part A covers hospital care. Part B covers doctor visits, tests, and outpatient care. and Part D covers prescription drugs. Many people also purchase either a Medigap plan to help cover deductibles and coinsurance, or a Medicare Advantage plan, which is a private plan that bundles your coverage together. You can apply online at ssa.gov/Medicare, by phone, or at your local Social Security office. Most people should sign up during their initial enrollment period. That's 3 months before your 65th birthday month, the month you turn 65, or 3 months after you turn 65. Although coverage does not begin until you have signed up, so you may have a gap in coverage if you don't sign up before age 65. Speaking of Medicare, we are in Medicare's annual enrollment period. And this year, more than many years, there's been a lot of noise around Medicare and premium increases, coverage changes. There was a Wall Street Journal article that was published about a month ago, which talked about 1.2 million people losing coverage for 2026. On this channel, we only have 3 affiliates, and our Medicare partner is Chapter. Chapter has access to all plans nationwide. They're totally free to you. They save their clients an average of $1,100 per year, and it takes about 20 minutes of your time. If you are on the right plan, they'll tell you. If not, they'll help you switch. If this is of interest to you, give them a call at 440-703-1224 to see if they can help. The next program is unemployment insurance. Unemployment insurance is a program that provides income to people who've lost their job through no fault of their own. And it's funded mainly by state and federal payroll taxes paid for by employers. Workers don't pay into the program, but their employers do, and those payments support weekly unemployment benefits. The fact is, millions of people receive unemployment benefits every year, particularly during recessions and big layoffs. To qualify, someone usually needs to meet 3 requirements. The first is that they need to earn enough wages in the recent past based on their state's base period rules. Second, they must be unemployed for a qualified reason, typically layoffs, company closures, or reduced hours. Quitting a job or being fired for cause generally does not qualify. And third, they must be available, able, and actively looking for work. Unemployment benefits vary by state, but most run for a period of up to 26 weeks and have extensions available beyond 26 weeks. People can apply on their state's unemployment website, by phone, or at their local unemployment office. They'll need to provide their employer information, earnings history, and evidence that they're looking for work. Next up, FEMA Disaster Assistance. This is one that most people miss. FEMA Disaster Assistance is a federal program to help people that have experienced disasters like floods, hurricanes, and a whole host of other related natural disasters. And FEMA is designed to provide basic essential help when their home or property is destroyed by a disaster. To qualify, someone must live in a presidentially declared disaster area. It's important to note that FEMA isn't designed to make someone whole again. It's not an insurance policy. It's there to provide basic help. FEMA assistance is also available if someone just doesn't have insurance, but if they do, insurance pays first and FEMA covers the gap. FEMA can directly pay for temporary housing, money to rent a safe place to live after your home becomes uninhabitable, home repairs, payments for essential repairs like roofs, floors, septic, windows, but not full restoration, personal property loss, limited payments for essential items such as beds, appliances, tools needed for work, wheelchairs, etc., disaster-related medical, dental, and funeral costs if those were caused directly by the disaster, transportation, payment for repairing or replacing a damaged primary vehicle, and other serious needs. These include cleanup items, child care, and accessibility needs. People can apply online at disasterassistance.gov, through the FEMA mobile app, by calling 1-800-621-3362, or by visiting a disaster recovery center. They'll need proof of identity, the damaged address, insurance information if they have it, and a short description of the damage. Number 6, workers' compensation. Workers' comp is a program that provides medical assistance and income assistance for someone who's hurt on the job. It's funded entirely by employers, not employees, and companies pay into the state workers' comp fund, and that is then used to pay out the necessary amounts to cover people that have been hurt. To qualify, a person must have received a work-related injury or illness. This can include accidents, repetitive stress injuries, toxic exposures, or illnesses caused by workplace conditions. The injury must occur while performing job duties, and it must be reported promptly. typically within a few days depending on the state. Workers' comp benefits usually cover all necessary medical treatment, a portion of lost wages while the person can't work, temporary or permanent disability payments, and job-related training in some cases. Number 7, federal student loans. Federal student loans are loans that help people pay for their own or their family's education. There are 2 types of federal student loans. One is called a Stafford loan, both subsidized and unsubsidized. The second is what's called a PLUS loan, which is available to graduate students and their parents, and these loans are funded directly by the federal government. Millions of students use these loans every year because they offer fixed interest rates, income-based repayment plans, deferment, forbearance, and even forgiveness options that private lenders don't provide. These loans are typically government guaranteed, which means the interest rate that they pay is much lower than if the student took out a private loan. And the government can't run out of Stafford or PLUS loans, meaning that there isn't a set amount. That's one of the reasons that these are considered entitlement programs, that and the fact that the government is keeping interest rates lower than the person would normally enjoy if they were taking out the loan on their own credit. To qualify, students must be enrolled at least half-time. Next up, government-backed home loans. Government-backed loans include FHA loans, VA loans, and USDA loans. These loans are not issued by the government, but instead by private mortgage providers, but they are guaranteed by the government, which keeps the interest rate low. This also means that people qualify with lower down payments, not perfect credit records, and flexible credit requirements. Funding works like this. FHA loans are insured by the Federal Housing Administration using borrower-paid mortgage insurance premiums. VA loans are guaranteed by the Department of Veteran Affairs using federal tax dollars plus borrowed funding fees. USDA loans are guaranteed by the U.S. Department of Agriculture using congressional appropriations and small upfront fees. Next up, medical bill help, EMTALA or similar. The Emergency Medical Treatment and Labor Act is a federal law that requires hospitals to provide medical assistance to anyone in need, regardless of their economic status. Hospitals can't turn people away because they're uninsured or unable to pay. Funding works differently than most entitlement programs. EMTALA is funded indirectly through federal requirements, Medicare participant rules, and hospital cost shifting. Hospitals absorb the cost and make up the difference through Medicare payments, Medicaid reimbursements, private insurance, and federal support for uncompensated care. If a hospital participates in Medicare, which virtually all of them do, it must provide this care. There are no income, age, or insurance requirements. Next up, mental health support programs. The 988 Lifeline is a government-funded mental health support program. It's a mental health hotline that anyone can call, text, or chat with when experiencing emotional distress. Support is available 24/7 and is handled by trained counselors at local crisis centers across the country. Many people also use 988 for help with substance use or if they're worried about someone else. The 988 system is funded through tax dollars, and local crisis management centers are often used to staff the crisis hotline. Next up, Disaster Supplemental Nutrition Assistance Programs. DSNAP, as it's called, is a federal program to help households buy groceries after a federal disaster. It provides short-term benefits, usually on an EBT card, but process time is quick and it's available to most people. It's administered by the state, but it's funded by the federal government, and the federal government reimburses the state with nearly all costs, including administrative costs. And finally, government home repair assistance. The federal government offers several home repair programs for people living in unsafe or unhealthy conditions. The first is called Rural Repair Assistance. It comes through USDA's Section 504 program, which provides low-interest loans and grants to low-income homeowners in rural areas. The second is the VA Home Repair Benefit, which helps eligible veterans modify or repair their homes through programs like the SAH and the SHA grants. And the third is Tribal Housing Programs. It's funded through HUD, helps Native Americans and Alaska Native families repair or modernize their homes on tribal lands. To qualify, homeowners must meet specific requirements like military service, disability, or tribal affiliation. Gang, I've got a question for you. How prepared are you really for retirement? To find out the answer, I've prepared a free report for you. It's called the Retirement Readiness Quiz. You answer 15 questions, and a 12-page report is emailed to you instantly, totally free, no catch whatsoever, no credit cards, nothing like that. If you're interested, go to holyschmidt.com/quiz, fill out the 15-question quiz, and you'll get the results instantly. On your 12-page report, it will rank you in different areas, and more importantly, your totally free customized report will give you suggestions on how to improve your specific situation. Again, totally free. Go to holyschmidt.com/quiz, and you'll get the report sent to you instantly after you're done filling out the 15 questions. If you like this video, check out that video, 5 Big Changes to Social Security in 2026. Also, if you have questions about Medicare, you can call this number here, 440-703-1224, to talk to our partner chapter about your specific situation. This is Jeff Schmidt, and I will see you in that video right there.